Hello, welcome to another episode of the DSL podcast. I'm your host, Dave Cole, and today our guest is Susan Hoang. She is the Vice President of Oncology Analytics at McKesson. Welcome, Susan.
Thank you.
Thanks for being here. First of all, what is Oncology Analytics? Maybe we can just start there.
Yeah. So oncology is cancer.
Right.
So cancer care. Oncology analytics is really around all the data and insights around cancer care. So one of McKesson's biggest programs and strategies is around cancer care. And I work for the U.S. Oncology Network, and it is one of the largest community oncology network in the country. We see 1 in 5 cancer patients at one of our centers.
Wow, that's impressive. And it's the treatment of cancer patients that you're focused on more so than anything from a sort of a pharmaceutical standpoint in terms of coming up with a cure, or is there?
Yeah, so all of the above. We have different arms of our company that does all the above, but specifically for the analytics that we do, we provide this analytics that supports all the data and insights around the care delivery. So everything from, if you think about how treatment is given, whether that's surgery, radiation, or chemotherapy or drugs, and to how you think about, the support for cancer patients and their family members and the caregivers. So thinking about social work, thinking about how do you think about the multidisciplinary team, the team of not just oncologists, the doctors, but the nurses, the pharmacists, the dietitians, the social workers that surround the patient and the caregivers that we support, the insights around that. And the other parts we think about in the healthcare ecosystem is, in addition to how care is given, you think about how it's paid, right? So our team does a lot of the analytics around the reimbursement or working with payers, thinking about the reimbursement for the treatments that are provided and the services provided for our patients. And as well as, because cancer care is quite expensive in our country. I don't know if you know that the average cost of cancer treatment is $150,000 per patient.
Wow.
And cancer is one of those that is usually in adult cancers is a disease of the elderly. So usually these are patients that are typically over 65. So most of those patients you think about are on Medicare, right? And those are fixed income folks, right? They're retired, they're on Medicare. And think about it, it's 20% out of pocket. 150,000, 20% of that is out of pocket. So that's pretty costly. So we have to think about access from not just treatment, but the affordability of treatment as well, and making sure it's appropriate and good quality as well.
Well, it's truly God's work. I mean, what you all are doing, it's got to be very fulfilling. I want to dive into that, and I'm going to come back to this. I want to talk a little bit about the agenda. So what are we going to be talking about in today's episode? One of the things that I think makes you very unique, Susan, is your background. Like, you did not start, with a traditional, stats, sort of math background. You were a pharmacist before you became an analytics leader. Is that correct?
Yes. Pharmacist, marketer. Yes. Yes.
Great. So we're going to dive into that, and I think it's the provocative question of what sort of background do you need to have as a DSL? I think there can be varied backgrounds, and you can be extremely successful coming from different walks of life. You need not have a PhD in statistics, and we're going to dive into that. The second thing is that I think is near and dear. It should be near and dear to every DSL's heart is driving measurable outcomes. So we're going to really deep dive into how should a data science leader be measured? What does success look like? We're going to talk a bit about some of the metrics that Susan uses and as a DSL, and hopefully it'll be sort of universal and good knowledge for the rest of the audience here. So first of all, let's get back into what we were talking about. So help me understand a little bit about the analytics that you're doing today. Yes, you want to keep care manageable from a financial standpoint. I mean, it is extremely expensive. Also, it sounds like there's quality of life, there's improvements in terms of treatment that you're also focused on. Like, but what sort of metrics are you looking at there? Like, what are you driving?
So I think our team kind of is the kitchen sink for the US Oncology Network. But if you think about the entire ecosystem to support a cancer patient, we touch the analytics behind all of that. So let's start with how we think about treatment decisions. Our team actually does a lot of the analytics to identify what are the treatment strategies that are best optimal by cancer type. And we actually provide the insights and the feedback to the caregivers on how they're performing, how they're benchmarking against other providers, as well as to the pharmacists and the other quality leaders who have to think about the population health approach to things. Now, in addition to that, we have to think about reimbursement. How does a provider get paid for the cancer care? And what you see in the healthcare world is the idea is that we have to bend the cost curve. It's just the pace that it's at is just unsustainable.
Yes.
And in order to do that, our team actually does a lot of the analytics behind the payer contracting. And it's not just what you think about as working with the payer contracting around, okay, here's the model, here's the performer, here's what we forecast. But we actually take on a lot of value-based care, which is really paying for performance. What is the paying on the outcomes of the patient? What's the quality of life of the patient? How well are we managing side effects? How well are we managing unintended hospitalization, emergency room visits? How are we managing their pain? And really, how are we managing the total cost of care for the patient as well, and the patient satisfaction? So if you think about all those aspects, there's a lot of different dimensions, and we have to think about everything from modeling and forecasting. What's the likelihood of payback in 6 months' time, and what's the likelihood we even have to think about reserving finance. So we do the financial analysis behind that, as well as we do the analysis and say, okay, 4 different aspects of care, how might we actually improve or find the insights that actually can improve where we are and where the opportunities are to improve care. So it runs the gamut, but we think about it as the holistic insights that support the ecosystem of cancer care for the network.
So there's a lot of things I heard in there that I just want to quality of life, pain management, total cost of care, customer satisfaction. So that'll be like patient satisfaction.
Patient satisfaction.
Yeah, patient satisfaction. For me, if I had cancer, patient satisfaction was kind of like, hey, am I doing better? Like it's more, I would think like the typical score would be more outcome based. Like, but is there, I imagine also there's the relationship that you have with the provider itself.
Yeah.
Like, do you feel like you're getting like, care that, the best, highest quality care? Like, so what is it a number? Like, is it a survey that gets sent out? Like, I'm just curious.
Yes to all.
Okay.
And there's a qualitative component. It's interesting. The definition of quality depends on the stakeholder. Mm-hmm. So to an employer or to a payer who's paying it, there's a different definition than what a patient defines as good satisfaction. We know in our industry what matters to the patient and their caregivers is how attentive a provider is. Do they have the time? Do they have the support of the oncology care team, not just the oncologist in supporting them through their care, not just on the care actually. Sometimes it's surrounding their entire socioeconomic situation. And then for a payer or employer who's really paying the check for the treatment, it's a little different. They look at more things like, what assurance do I have that there is a reduction in variability in the services I will get from your providers, your network, as well as the quality of care that's you're given, so that it's a balance of quality and cost, and that's really the equation for value, right? What guarantees can we have that we have good value and predictable value for the care that we can receive for our members, as they say in the payer world? Okay.
That makes a lot of sense. I'd like to now dive, like, if we can sort of turn back time a little bit. I want to hear a little bit about your journey in becoming a DSL. Like, like how help us understand how you got there. I mean, from starting in the sort of more traditional pharmaceutical world and even marketing and now to where you are today. Just
Yeah.
give us a sort of high level on how that all happened.
So I would say my career has been a winding path, but what unites my path is really a true belief in patient care and access to care. And I think I'll start with I started off not thinking I was going to go in healthcare. I started off very much. I was an international relations major in undergraduate. I actually did a lot of economics. My training was in economics, so I did really well there. Thinking I'm going to travel the world after I got my undergraduate degree, but being a dutiful Asian daughter, I said it must be healthcare. So I was able to find a program at UCSF where they focused on pharmacoeconomics, health policy, and pharmacoeconomics. And that's the discipline of economics, but looking at the treatments and drugs specifically. And that's where I got my doctorate of pharmacy. From there, I did a lot of clinical programs where we focused more on how do you think about treatment formularies? How do you think about the cost from a population health perspective? How do you make sure that patients have access to care, but making sure it's thinking about the balancing of cost and affordability and access to treatment? I did that for some time, and I actually did had really fun jobs in all of that. But it was one of those things in life. Sometimes you don't know where you're going to go next. And my husband and I had a moment where we were deciding I wanted to stay on the West Coast. He wanted to go to the East Coast for his training. Mutual assured destruction was to go to Texas. We said, for sure, we're not going to
split the difference. Yeah.
Yeah.
Just go to the middle.
But here we are. How many years, decades later, we're in Texas, and it was interesting because at that time, I was introduced to a whole new career doing global strategic marketing at GE.
Oh,
And
wow.
I thought, perfect. I can go back to some of my global aspirations back when I was in undergrad, and I was afforded the opportunity to do work at GE and look at cancer care across the globe and how care is delivered differently, and the needs are slightly different, even though the unifying theme is cancer care. And it was a great time in thinking about how might one think about cancer care needs and what are the portfolio GE had to be able to put together surrounding the cancer care. What was interesting is after 7 years at that, I realized maybe global traveling does lose its luster. We were on the road all the time in a suitcase.
Right.
So
Right.
there I was actually tapped on the shoulder at McKesson and asked, "Hey, we have a situation. We have a turnaround situation in pharmacy, and was wondering if somebody with your background could you help us?" And I joined the organization with the intention is that, hey, pharmacy, back to some of my pharmacy roots, but with the eye in mind is that I did share with the leadership team there that I would love to explore something new and different.
Mm-hmm.
And I would say that's where I'm landed today, doing analytics, because that's one of the key things I recognized in my tenure at McKesson was how important it was to have data to drive the decisions behind it, and so it's not just on experience or conjecture.
Mm-hmm.
That the decisions that are made, how might we elevate the decision making through the data and insights? And so that's where I'm at. But I would say what's neat about my entire career is I've been able, every job I've been in, I've always been the first at it. So I've been able to define it as I go. So it's been fun, and I'm enjoying where I'm at now.
That's great. But I feel like we skipped over. I mean, you had at GE, you were doing you were doing marketing, right? And then you had this opportunity at McKesson to. Did you go to McKesson and start as a DSL, like start as an analytics leader, or do you go there, setting up some program and then said, hey, I really want to, I really want to lead an analytics team. Like, I want to understand, like, first of all, why did you want to do that? And then second of all, like, how did you convince someone that given your background, like that you were the right person for the job?
So one nice thing about McKesson is they're very open with folks who are willing to take calculated risks. And
Hmm.
one of the opportunities they saw and I saw was the idea is we had pockets of analysts all over our business unit. The question was, is there an opportunity to combine different disparate teams to be able to do more by seeing more? And that was the opportunity we had was how might we consolidate various previously siloed teams, come together as one unit to support the U.S. Oncology Network.
So there was a bunch of siloed teams that were focused on, I think, what you said at the outset, which was all these
Yeah,
oncology care,
yeah,
payer-related challenges. And you're like, hey, like if we consolidated them, I think we can make them more productive by working together than them all being out in these various silos. So this was, I'm going to put this on you. I'm going to put you on the spot here, Susan. This was your idea. You saw this. You pitched it, and then somebody said, yes, I see what you see too, Susan. I think you should bring these folks together and sort of herd the cats and manage them, and have them more collaboratively. Did I
yes.
put words in your mouth, or is that
No,
how
I
that went?
think that's a good summary of the journey so far. Yes.
Great. Well, I think sometimes people, when you look back on your career, you sort of skip over these
Yeah.
monumental these risks, right? That you take, and I think that's fantastic. I think seeing inefficiency, raising it up. I mean, I'm curious. Like, was it a coffee conversation, or did you put together like a deck? Like, well, how did you actually? Do you remember
Probably,
recall how that happened?
yeah. It's probably series of various different
Yeah.
conversations, thoughts, jotting it down, having other conversations, pulling it together, and really having good support from leaders who say, okay, here's a risk, go for it, right?
Right.
And so it takes a little bit of both, and being also lucky, being set up in a situation where around the organization there were parallel conversations of the commit around analytics being a big part of the larger company's organization strategy. So it was a combination of luck, um, and timing, and also willing to challenge myself in a different way, but also the idea that you can't do it alone. You've got to the team has to want to do it too, right? So that's the piece that is interesting about a
Great.
turnaround realignment situation.
I'm of the opinion that you sort of, I mean, yes, there's luck, but I think a lot of times you make your own luck, and the fact that you saw saw this sort of problem, you saw this opportunity, and the fact that you had those conversations, you aligned the various folks. I mean, that takes skill. That takes a lot of skill, and that takes that's what great managers do is they see these inefficiencies and they take chances. And sounds like it's worked out great. I'm curious to know. Given I imagine your team has a mixture of sort of data scientists and engagement managers, things of that nature. How has it been managing them? Have there been any challenges for you, or do you feel like there's a lot you learned throughout your career that has been very helpful?
All the above. I would not be telling the truth if I said it was what do they say? Blueberries and lemonades. Although somebody said that blueberries are very vicious, so bluebirds are very vicious. So it may be bluebirds, but I would say it's a bit of both. I think one of the things I was able to take from my past experience is the idea is sometimes it's okay to start from new. It's okay to start with a challenge because sometimes within constraints, resource constraints, you might find the most uh, most brilliant idea to innovate. And so I have a track record of building teams, turning around teams. So I use that experience. But in addition to that, it was with the team I had, coming under one leader when you were in different groups, it must come with some skepticism, right? I
Right,
mean,
right,
is your job on the line? Is what else is going on?
yeah,
But the picture you have to paint for everybody. And even if you are a leader, I always say this to everybody to my team is just because you have a title doesn't mean you can't influence without it. You must influence without authority. Actually, it's
hmm
the higher up you go. Actually, I believe the better skilled you must be at influencing without authority. Because because there is no way you can get folks to do anything unless they believe in it too. So that
Right.
shared vision of what needs to be done and why it needs to be done, and that was the picture I was able to paint. And still in painting for the team, right? The transformation's not done. We're still working on it. But I think also the other thing is, I know I'm not a classically trained data science leader, but what you do is you surround yourself with folks who buy into this vision of a team, have the right skill sets and different skill sets. So I think of this way. I always explain it to my team is, think of a superhero team. Everybody has their own special superpower. But when you come together, that's when you really can do a lot of amazing things. So the Avengers, the Incredibles, they each have their own superpower, but when you come together together, that's the difference maker. And that's the philosophy we have taken with our team coming together in this way.
Yeah. I mean, diversity of skills, right? In terms of, that Avengers sort of analogy, I think makes a lot of sense. But I think if I'm working for you, what is coming through just in our conversation here is, the passion that you have for solving a very gnarly problem with regard to cancer is obviously one of the deadliest diseases that we know of today, and trying to tackle that very challenging. And then you have healthcare, which is perhaps the most complicated industry on the planet, at least in the U.S. Yeah. And then you combine those two things, and and there's just challenges everywhere. But the fact that you have that passion, you understand the problems acutely, and you know how to, what the various sort of business counterparts, whether it be the provider, the payees, et cetera, are really looking for, can help drive and focus, a team that may not be, maybe well versed in certain parts, right, of the problem, but may not see, the sum of the parts.
And so our team's makeup is a mix of both clinicians with a background in informatics who understand the data, and then as well as data engineers, data managers who understand the data piece. Because to your point, if you're right, healthcare is complex, so the data is very messy. We call it the swamp, because you got to mix the electronic medical record data mixed with claims data, mixed with financial data, mixed with third-party data, and it's not even the data itself that's messy. Even having to think about our multi-cloud, multi-platform strategy. Some things are on-premises, some things are not. And so our team must be able to put their feet in two canoes. In our world, there's no simple, this is the simple, clean platform, and that's the way it goes. And it's interesting, we've had many team members come from other industries like finance, who have, I think, healthcare is not as sophisticated as other industries when it comes to analytics, but others that have come in with that kind of background even admit healthcare data is very messy. And what's unique is oncology data particularly is very messy because of the complexity of the cancer types. Oncology cancer is not just one disease, it's actually many, many diseases. So that's the challenge with it.
Why is it that? Why do you help me understand? What do you mean by cancer is actually many diseases?
Yeah, good question. So the etiology, the biology of the disease is different. So when one says I have lung cancer, the tumor markers behind it, or I have breast cancer, the tumor markers behind it is very different. And so how you treat a patient on that is very different. Even how it manifests when the disease advances typically goes to different organs are very different. So one must have to think about how you treat it very differently. And even this cancer doctors subspecialize. So some doctors might exclusively only see a certain type of cancer patient.
Right.
Brain cancer doctors are very different than a breast cancer doctor, or even the types of doctors. So a cancer patient may see a surgeon, a radiation oncologist, and a medical oncologist just to treat one cancer. And so it's quite complex compared to, I would say, even other chronic diseases.
Yeah. That makes total sense. How let's segue into the measuring outcomes.
Yeah.
So that is, very, again, near and dear to all of our DSL's hearts.
Yeah.
What are some tips and tricks that you have
Yeah.
for how you want to be measured and what success,
Yeah.
how you define success?
So at the end of the day, our philosophy is it's how do we measure our impact for patients and our patient care, and how do we support the clinicians that deliver the care. So oftentimes before the beginning of a fiscal year and throughout a fiscal year, we actually partner very closely with other departments and divisions and actually interlock our goals. So if there is a key target to improve hospice, improve advanced care planning, we tie ourselves to the ultimate outcome and not just to deliver a particular report or to a particular project. It's actually to the end target. So dollar saved, dollar generated, what's the shared savings target? We tie it to that measure. We don't measure ourselves on incremental deliverables, if that makes sense.
Gotcha.
And we share it with our business partners.
And what does that interlock look like? I mean, so somebody's putting together high level targets of sort of dollar saved or I don't know, increase of the patient satisfaction score or what have you, right?
Yeah.
How do you say, okay, we're going to focus on these four key initiatives, but not these other two, and here's how we're going to help, et cetera. Like, what does that look like?
It usually is a interactive process. It's an ongoing process, and we'll start off in the beginning of the year with a whiteboarding session where we say, okay, what are the big goals? What are the aspirational things that we need to go after? And then when we get that shared target, then we work with the other departments and say, okay, what would it take? Let's work backwards. If that's our end game by the end of this fiscal year, let's walk backward and see what would it take to get there. And a lot of times, even to feed that discussion of what should be our big picture aspirations for this fiscal year, we come in there with some ideas and opportunities. Like we can say, here's what we look like today. Here is where we think the opportunities might be to improve, and then go from there. Sometimes that helps inform kind of the decisions of what should be prioritized as well. And what we also push for is we follow really two key philosophies in our principles as a team. The idea of design thinking is you start with what is the biggest pain, what is the biggest need that needs to be solved for, and then figure out how to build prototypes, or I'll call quick prototypes, with the mind is what's the fastest and cheapest way to test whether it's working or not, so that we can measure and learn, and then improve on it. We do not take the approach of build and then they will come, as best as we can. And we will challenge even our fellow colleagues in different departments. How do we know? How do we know this works? What's the signal? We'll ask for that up front, and we agree to it as a team, and we work on it that way. A great example of that might be the opportunity we worked on around end of life care. We found an opportunity that we could really improve on advanced care planning and patients' care at the end of life. And so with that, we found the opportunities that the biggest need was when it came to care delivery from a multidisciplinary approach. Sometimes you kind of need numbers and not just the qualitative aspects of a patient's care to have that conversation. So that's where we applied machine learning and built a model and said, can we help figure out and predict the mortality risk in the last 90 days for the last 90 days of life? Not to replace decision, but actually just to help supplement a care team's decision making, if that makes sense.
So was this predicting outcomes based on various treatments at end of life care? Like what treatments might extend?
Symptoms is a combination of patient symptoms, the patient's treatment, the patient's disease, all the above. So all the clinical parameters that might be behind it to feed into the model. Now, what was interesting about it is with the data science team that we work with, we pushed and said, actually, before you go there, start with interviewing the care teams, flying out to see the practices, seeing how their care is given, interviewing patients, interviewing care teams, so that they understand all the different aspects of need first. And then on top of that, what we did was we then made sure that we had oncologists who are invested in this actually work with us so that we were co-creating with the customers in it. And then along the way, we pushed and said, can we go faster? Meaning, what would be a good enough prototype? And also having those tough conversations about what's a good enough sensitivity and specificity rate to be able to say good enough, and what's the tolerance for that. Those kind of decisions need clinicians, need oncologists to buy in on it. And what's neat about it is the speed at which we were able to build the model, test the model, and how fast it was bought in. And I think what was interesting about it was, I think sometimes the customer could be your biggest advocate. And the neat thing about it is that we made sure that the machine learning was not a black box, that it was defensible, it was transparent, and that goes a long way with getting buy-in from oncologists and the care team, right? You want to know what's inside it. You're not going to trust a model that you're not sure how it was created, how it's made, and how it's maintained.
Yeah, I think explainability is certainly a hot topic, but explainability in healthcare and certainly in the oncology treatment certainly is paramount. It'd be tough to get oncologists and clinicians to jump on board if they didn't trust and understand the model. But I think one thing that you clearly, your background sort of brought to the forefront was you have a passion for, like, let's actually get out in the field, let's talk, let's bring in. I talk about business users and the business side all the time on the DSL podcast, but really in this case, it's talking to the clinicians, it's talking to the oncologists, understanding what their pain is, what their frustrations are, and making sure that this model that you're building is actually going to, fit a need. And when you say, like, hey, they bought in, well, of course they did, because you brought them in, like your team brought them in from the outset, right? They were part of the journey. They understood your goal, even how I'm guessing, how you were going to go about it. And then when the model was built, understanding a little bit about data science and the fact that it's not a black box made me think that when you said it's not a black box to them, made me think that you actually taught them, what machine learning is a little bit and that kind of thing.
And it was really fun, right? Because when it came to the field piloting phase, right? The other thing with data science is you can tinker forever. But at what point do you say, okay, let's call it, let's get out in the field and see if we can get practices to pilot it. And so the idea is, what's the level of fidelity that you need at each stage in order to get to the next stage? And so, to me was that by having oncologists up front be a part of it, they were the best spokespeople to even recruit the next round of pilot sites, right? So that they can speak the language of an oncologist and they can speak firsthand from their own experience piloting it, and then that's how we expand. I think that's the biggest piece in order to make sure that you actually de-risk or reduce risk in any innovation by actually approaching it with a design thinking approach. Start small, think about what is the prototype, the fastest, cheapest way to test, and get it into the field.
Right. So a couple things I learned here, Susan, on measuring outcomes is, the first one is if you have a company culture where you have, I don't know, annual or quarterly goals, like bolt onto those and show how you can be of assistance and how you can help achieve those goals. Like that's easy, right? That's a layup, right? The second thing I heard is when you're coming up with when you're working on your own projects, like get that buy-in early, go a sort of a proof of concept, proof of value type approach before you just build it and assume it's all going to go to plan, and build consensus, right? And then you grow from there, right? Then you can really expand if it's working. If it's not working, then hey, you didn't waste more time and resources than was needed. And you try a different approach, right? So I think that helps at the end of the end of the quarter or end of the year when you're looking back and trying to see explain how your team performed. You're not the only person singing the praises of your team. You have folks out in the field doing the same, and I think that is critically important.
I agree. I think the idea is who's going to advocate for you when you're not in the room. And
Right.
that's the piece that I think is really important in science, because it's new, and to many business leaders, it's foreign.
Yeah.
Actually, they're not sure how to leverage it, and that's the piece that I think our team is a little different.
Yeah, and I think you're showing how to leverage it with each project and with each sort of oncologist or provider,
Yeah,
what have you, that you win over with the work that your team is doing. So I think that's fantastic, great advice. Hey, I've really enjoyed this, Susan. This has been really interesting. I think you certainly have shown that you do not need to have 20 years of statistics and coding and machine learning. If you truly understand what your business users want and need, and you have a passion for understanding their problems and then reflecting that back, and explain and working with your team to deliver those the solutions to those problems, you can be fantastically successful, and clearly you have been. So
yeah. Thank you. This was fun.
yeah, this has been a lot of fun. So if people want to get in touch with you, Susan, can they reach out to you on LinkedIn, or do you have any other social media?
LinkedIn.
LinkedIn. All right, great. Well, Susan, thanks so much for being on the DSL podcast. I had a blast.
Thank you, Dave.